Good morning, everyone. We are from Team Megatron, and today we will present our analysis on the distribution of healthcare departments across different regions. Our goal is to uncover patterns in healthcare availability and understand how these factors impact patient access and service distribution. Okay, so right here is the map shows patient home location, where each dot represents the geographic distribution of patients across the Kansas region. From this visualization, we can see the patient density is more concentrated in the eastern part of Kansas. From a geographical perspective, this eastern region also has the higher number of clinic departments, right here, Topeka, due to its strategic location in the east, where population density is higher compared to the western region. In addition to that, its position along the Interstate 70 corridor allows easy access for multiple direction due to easier highway access. Cities such as Topeka benefit from this accessibility and act as a key healthcare centers. The region is also surrounded by smaller towns like Osage City, Holton, and Wamego that have limited healthcare facilities. As a result, the higher patient density combined with strong accessibility and a centralized referral system explains why clinic departments are concentrated in the eastern region. So right here, this slide highlights the top 5 most common cases where fractures such as lower leg, forearm, wrist, femur dominated, followed by intracranial injuries. This clearly indicates that a significant portion of patient volume is driven by trauma-related conditions rather than chronic diseases. When we connect this to the data below, we see that Kansas records a motor physical death rate of 13.2 per 100,000, compared to the US average around 12. This is noticeably higher, and when benchmarked against lower risk states, some of which are below 8, this gap becomes even more significant. This suggests that Kansas experienced a relatively higher burden of road-related incidents, which likely translates into a higher number of trauma cases. Overall, the data suggests a strong linkage between road safety conditions and healthcare demand, where higher accident rates lead to increased trauma cases, greater departmental involvement, and higher system loads. So right here, this slide presents a fragmentation analysis comparing disease volume with the frequency of hospital or department switches alongside the departments most involved in patient transfers. On the left shows how often patients switch departments relative to the total number of visits for each diagnosis. We can see that conditions like type 2 diabetes and joint disorders not only have high patient volume but also have a higher number of department switch. Interestingly, some diagnoses such as general examination without specific complaint also show very high switching frequency. This suggests a pattern of diagnostic uncertainty or broad screening processes, where patients are routed across multiple departments before a clear diagnosis. On the right, we can see that departments with the highest number of patient transfers, units such as orthopedics, radiology, laboratories, and emergency departments, dominate this list, reflecting their role as key connectors that support diagnostics, imaging, and initial patient triage. However, as we look deeper into the data, we notice an important anomaly. Diagnostics units like CT scans and 911 lab shows transfer rate approaching 100%. We define this phenomenon as structural routing. This does not indicate poor patient's care or inefficiency. Instead, it is an administrative artifact of our data system records, such as 15-minute imaging sessions or just a separate department visit. Overall, while the data shows that higher patient volume is associated with higher fragmentation, part of this fragmentation is structural rather than clinical. Therefore, improving the data is essential to that this diagnostics so we can capture it more accurately. Thank you, everyone.